I'd like to thank the organizing committee and Dr. Amani Al-Falasi for having asked me to speak today. So I want to talk about this combination of ultrasound and endogenous enzymes in facial contouring, namely in refining the lower face. We know that basically facial shape is a huge determinant of female beauty. And this has been published basically that the ideal shape is an oval with prominent zygomatic and malar prominence and a refined jawline, a slim lower face. So irrespective of how ideal a patient is in youth, we know that things change with time, and we have seen that what we get is actually a facial squaring or quadrilarization of the face, wherein the focus of attention in youth is the mid-face. With time, with older people, our focus of attention becomes the heavy lower face. And this is mainly due to various anatomical changes culminating in an inferior medial descent of the tissues of the face. And this results in the formation of jowls, and jowls are a feature which characterize older faces and due mainly to transposition of the superficial fat pads, namely the superficial jowl fat and inferior jowl fat. And these are actually kept in a lower position by the malar septum, which acts as a sling here and ends up with this kind of characteristic clinical pattern of the jowl. However, with age and time, we also have excessive fat in the submental area. So submental fat is also one of the characteristics of aging. But when we come to address this, we need to actually define whether this submental fullness is due to pre-platysmal or post-platysmal fat. We know very well that we can only target pre-platysmal fat with all of our techniques, non-surgical techniques. And it only takes open surgery to be able to address post-platysmal fat. So we need to assess by this kind of maneuver, a pinch test, where we pinch the submental fat and we ask the patient to swallow to be able to determine whether the fat is beneath the muscle or on top of the muscle. However, lower face fullness is not only a characteristic of aging. Lower face fullness is found in younger people who have gained weight, who are overweight. And we see, for example, in this case, this patient, she is basically very beautiful. She has excellent skin, beautiful features. She's very symmetrical. However, this excessive submalar volume and double chin detract from her beauty. So this is a situation which we have to address in older individuals and in younger individuals. So we need a means which is safe and effective to reduce lower face volume. So what we have been using in our practice is a combination approach of ultrasound, and immediately after the ultrasound application, we inject a cocktail of enzymes in the treated area. Both of these treatments individually are highly effective, as I will show later on, but when we use them together, they give us a synergistic compounded effect. So the ultrasound, what it does, it's a patented technology which literally lyses the adipocyte cell membrane. So we actually end up losing a certain number of adipocytes. Furthermore, it increases the temperature of the tissue to about 40 to 42 degrees centigrade in the treated area, which actually activates the lipolytic enzymes. So compounding it with injections of lipase, hyaluronidase, and collagenase enhances lipolysis. These injections do not lyse the membrane of the adipocyte cell. They simply increase the conversion of triglycerides to free fatty acids and glycerol. So as you see, we have two different mechanisms whereby we are able to reduce the fat pad in the lower face. With all of our patients, before we start the procedure and also before each and every session, we do a body composition analysis. Basically, we do not want the patient to gain weight or lose weight. We want to ensure that the results we see are purely due to our treatment. Then we have 2D and 3D stereophotometric imaging to be able to assess the results. So first of all, the ultrasound technology. We know that ultrasound can be either as longitudinal waves, these are known as compression waves. Most of the technologies on the market that use ultrasound are using these kind of waves, which can create pressure and heat and can be quite painful. However, there are another kind of wave which is known as a transverse wave. These actually are selectively lytic for the adipocyte cell membrane. And the technology that we use actually combines both longitudinal and transverse waves, and these are called to produce LAM waves. LAM waves are very gentle, they're effective, and they emit the certain frequency which corresponds to the frequency of the adipocyte. Hence, they are able to literally lyse the membrane of the adipocyte. The adipocyte, which is mainly consists of a big lipid vacuole, due to their actually spherical nature and their large size of 50 to 150 microns, it is easy to vibrate these cells, as opposed to other cells in the body which are much smaller. So when we vibrate these cells, we can actually selectively damage the membrane and release the fatty components in the bloodstream, which are then transported. And this is aided by the fact that we increase vasodilatation due to the heat that we produce in the tissue. So we have various types of damage, which we can see on histology. The membrane shape is altered. We have disruption of the membrane and areas of lysis. So these are typical examples of what we see with only this technology, only the ultrasound. We see one session refining the jawline. Here we have 2 sessions. It's highly effective. However, we like to satisfy to ourselves that we have objective data to prove that this works. And more this is being used in studies whereby we have 3D photography, where we can, for example, see the before and after, and the special software will superimpose these images and look at distance difference between the 2 images. We can see in blue color a decrease in volume of 4.2 cc after 1 session. So this is objective, quantitative data that this treatment works. Now, what about the recombinant enzymes? These are enzymes that are produced by genetic engineering. Basically, a gene that encodes for a specific enzyme is inserted into a bacterium, and the bacterium can then produce this enzyme in large quantities of high quality, purity, and specificity. So we know that as compared to animal enzymes, these bacterial enzymes, being a low immunoreactivity and non-glycosylated proteins, they are much smaller in size and have high safety. Here we see that the enzymes are a cocktail of collagenase, lipase, and hyaluronidase. The lipase is the one that is actually causing the lipolytic reaction. The collagenase and hyaluronidase increase tissue perfusion of the lipase. The enzyme activity is actually affected by pH. Therefore, we're very careful not to add too much anesthetic, local anesthetic in our cocktail, because it might alter the pH. Temperature, and we can see exactly here that the optimal temperature is 40 to 42 degrees centigrade, and the substrate concentration, namely the amount of fat in the area. So we see what the lipase does. It enhances this reaction, triglycerides to free fatty acids and glycerol. So these leave the cell, and you have a shrinking of the adipocyte. So the adipocyte gets smaller. And these are our results with only the lipolytic cocktail, without ultrasound, only lipolytic cocktail. After 2 sessions, you see a refinement of the lower face. And if we see superimposing the silhouette of before and after, we have a clear reduction in the volume and an improvement in the cervicomental angle. However, it is obvious that a lot of her fat of this model is post-platysmal. But we can actually measure the amount of fat that she's lost in 2 sessions, which is 24.5 cc. So this is another example how we see progressively after 1, 2, and 3 sessions, progressive increase in intensity of the color, meaning progressive increase in breakdown of fat and elimination of fat. And you can see the jawline is much more refined after a series of 3 sessions of the enzyme. So what about the concomitant application of ultrasound and injection lipolysis? So this can be done every 2 weeks. The ultrasound is applied, and immediately the enzymes are injected. As I mentioned, the Q10 effect increases lipolysis due to the increase in temperature. And here we have example of 1 treatment session. This patient was actually considering buccal fat removal, and just after 1 session, she has an improved refinement of the lower face. You can see her jawline is beginning to appear with a 15 cc reduction on the left side. And again here, the jawline is beginning to appear, and 11 cc decrease in the right side. Here also, 1 single session. She wanted to be slimmer in the lower face, so she was slim to begin with, only 3 cc reduction more or less on both sides of the face, and her submental area, which was distressing her, 19 cc reduction. This final case, she had to receive 4 sessions. She was our model, which was really heavy in the lower face. You can see a very nice improvement and refinement after 4 sessions with almost a 27 cc reduction in volume. And look at the profile. You have a much better angle of the mandible and the 16 cc reduction on one side and another 13 cc in the other side. So there is no doubt that the combination of these patented ultrasound LAM waves and recombinant enzymes give us a very safe and effective reduction of lower face volume. Results typically are seen within maximum 2 weeks, and even before then. And because the results are so evident so soon, the patient is motivated to come and continue the treatment. And it's very comfortable, no swelling, almost no downtime, except if there is any little bit of bruising from the needles. Thank you very much.